Hi everyone, I'm Nazamaris. In this video, I'll be talking about the natural family planning method. Understanding your cycle is very important in natural family planning. When you observe the changes in your body, you'll be able to identify the period you are most fertile to help you know when to abstain or engage in sexual activity. The natural family planning method involves tracking menstrual cycles and avoiding intercourse during fertile days. They are the calendar method. The calendar method is one of the oldest natural family planning methods. It involves tracking the duration of your menstrual cycle to predict the fertile days. A menstrual cycle normally lasts between 28 and 32 days. Ovulation usually happens around the 14th day, so you avoid unprotected sex on the days you're most likely to be fertile, which is the 8th to 19th day of the cycle. To count it, take note of the first day of your menses. You start counting from the first day of your menses. Also take note of the first day of your next menses, then count the total number of days between the first days of each cycle. This method will not be as accurate if you have an irregular menstrual cycle or when your cycles are shorter than 27 days. Cervical mucus method. Here you observe changes in cervical mucus consistency to know when you are fertile. There is a change in cervical mucus before ovulation, and this aids the passage of the sperm. Your mucus is clear and slippery. It looks like raw egg whites when you are ovulating. Women can use this secretion to track the period of their fertility. Basal body temperature. This method depends on the little rise in temperature during ovulation. You take your temperature every morning before you get out of bed. Symptothermal method. This method uses a combination of the basal body temperature method and cervical mucus method to identify the fertile and infertile days. Lactational amenorrhea method. This method depends on breastfeeding as a natural contraceptive during the first 6 months after giving birth. It is only effective when the woman is fully breastfeeding, not seeing her menses, and the baby is below 6 months. One of the advantages of the natural family planning method is that it doesn't use hormonal or chemical contraceptives, so there is no side effect or medical contraindication. The disadvantages is that it requires a higher level of dedication and consistency. It also requires abstinence of barrier methods like the use of condom, diaphragm, etc., which some couples may find challenging. This ends our topic of natural family planning method.